Hello, I'm Dr. X. Today, we're answering a very common and practical question: do I really have to see a doctor if I catch the flu? Every year, millions of people come down with influenza, the flu, and most wonder whether they should tough it out at home or make a trip to the doctor. The short answer is, it depends. For many healthy people, the flu is unpleasant but manageable at home. However, for others, it can become serious or even life-threatening. Knowing when to seek medical help can make a real difference, sometimes between a week of discomfort and a trip to the hospital. In this video, I'll break this down clearly in 3 parts, first with simple logic and everyday examples, then with the physiological realities and risk factors, and finally with clinical guidelines and evidence-based recommendations. By the end, you'll know exactly when you can rest at home and when you should see a doctor. Let's start simple. Think of the flu like a bad storm. For most people with a strong house, a healthy immune system, the storm causes leaks and messes, but the house stands. You clean up, stay warm, and wait it out. But if your house is old, has weak foundations, or you have young children inside, that same storm can cause serious damage. You don't wait, you call for help. The same applies to the flu. Most healthy adults under 65 can recover at home with rest, fluids, and over-the-counter symptom relief. However, for young children, older adults, pregnant women, or anyone with underlying conditions, like asthma, diabetes, heart disease, or a weakened immune system, the flu can quickly turn dangerous. Let's explain it with an everyday example. A 28-year-old fit person gets the flu, high fever, body aches, fatigue. After 4 to 5 days of rest and paracetamol, they start feeling better. No doctor needed. But take a 68-year-old with diabetes who gets the same flu. On day 3 they develop shortness of breath and confusion. That's when they need to see a doctor immediately, because the flu can lead to pneumonia, worsening of chronic conditions, or hospitalization. As a simple rule of thumb, if you're otherwise healthy and improving after a few days, you probably don't need a doctor. If you're in a high-risk group or things are getting worse, don't wait. Now, let's understand what the flu actually does to your body. Influenza is a respiratory virus that infects the cells lining your nose, throat, and lungs. It triggers a strong immune response, which is why you get fever, aches, and fatigue. In most cases, your immune system wins the fight within 7 to 10 days. However, the flu can cause complications in several ways. It weakens the lining of the airways, making it easier for bacteria to cause secondary infections like pneumonia. It puts extra stress on the heart and lungs. It can trigger inflammation throughout the body. This is why certain people are at much higher risk of serious complications. They are adults 65 years and older. Children younger than 5 years, especially under 2. Pregnant women, especially in the 2nd and 3rd trimester. People with chronic conditions, asthma, COPD, diabetes, heart disease, kidney disease, liver disease, or weakened immune systems. People with obesity, BMI equals or higher than 40, and residents of nursing homes or long-term care facilities. When it comes to behavioral reality, many people wait too long because the flu starts like a bad cold. By the time they realize it's serious, they're already very ill. Early medical attention, especially antiviral medication like oseltamivir, Tamiflu, works best when started within 48 hours of symptom onset. Real example from my practice: a 52-year-old man with mild asthma thought his flu was just a cold. On day 5 he developed severe shortness of breath and ended up in hospital with flu-related pneumonia. If he had come in earlier, we could have prevented that. Here are the practical warning signs. If you experience any of these, you should contact a doctor or go to urgent care or emergency department. Seek medical care right away if you have difficulty breathing or shortness of breath, persistent chest pain or pressure, sudden dizziness or confusion, Severe or persistent vomiting. Flu symptoms that improve but then return with fever and worse cough. High fever that doesn't respond to medication, especially in children. Bluish lips or face. Seizures, or not waking up or interacting normally, especially in children. You should also see a doctor if you are in a high-risk group and have flu symptoms, even if they seem mild. For most healthy adults, stay home, rest, drink plenty of fluids, use paracetamol or ibuprofen for fever and aches. Antiviral medicines are usually not needed unless symptoms are severe or you're at higher risk. It should also be noted that antibiotics do not work against the flu, it's a virus. They only help if a bacterial infection develops later. At any rate, prevention is still the best strategy. The single most effective way to avoid this dilemma is to get the annual flu vaccine. It reduces your chance of getting the flu and makes it much milder if you do catch it. Good hand hygiene, avoiding close contact with sick people, and staying home when you're ill also help. So, do you have to see a doctor every time you catch the flu? No, not if you're a healthy adult under 65 and you're steadily improving. Yes. If you're in a high-risk group, symptoms are severe, or you're getting worse instead of better. Listen to your body. When in doubt, it's always safer to call your doctor or visit a clinic. Early action with antivirals or supportive care can prevent serious complications and even save lives. Thanks for watching. I'm Dr. X. If you or someone in your family has the flu right now and you're unsure what to do, leave your question in the comments or contact your local healthcare provider. Better safe than sorry. Stay healthy, get your flu shot every year, and I'll see you in the next video.